Hi, I'm Max Moullin from Sheffield in the UK, and I'm director of the Public Sector Scorecard Research Unit. And that focuses on the Public Sector Scorecard, which is a framework for systemic change and performance management, which I first shared in my book, Delivering Excellence in Health and Social Care, back in 2002. And it's been used in health and public services in very widely in six continents. And like the balanced scorecard, it has a strong link between strategy, processes, and performance measures. That rather than focusing on profit and shareholder value, it focuses on the outcomes that matter to service users and other key stakeholders. And they include the strategic outcomes, which are central to what the organization or the department is trying to achieve. Often it's actually a number of departments working together, for instance, like reducing obesity, which would have social care, public health, etc., and hospitals all working together. And but also the outcomes that are relevant to service users, stakeholders, and also financial outcomes such as value for money and sustainability, environmental, social sustainability as well. So we're focusing on the outcomes and then and then it works by developing a strategy map which looks at the outcomes first of all, then thinks at the processes, how we're going to achieve those outcomes, and then looks at what I call capability and organizational aspects which are required for those processes to work. Many processes look great on a wall, but they don't work because there's not adequate partnership working, there's not the support from top management, there's not the resources required, maybe because there's a blame culture. And so it has three phases. First is developing the strategy map. Then it's about service improvement. We've got this. This is what we're trying to achieve. How are we going to do it? What can we do differently? And then the final stage is measuring progress. And the strategy map is used to measure progress. We just measure the progress on what it is we want to achieve. And the underlying principles of the public sector scorecard actually seems to me very aligned with those of the forum. For example, a paper from Morocco, which was published last month, it looked at 10 models that had been developed to measure and enhance organizational performance. That included the balanced scorecard and the excellence model. And it concluded only the public sector scorecard emerges as an effective model for the public sector by emphasizing stakeholder participation, results focus, and continuous process improvement. The public sector scorecard offers a robust framework for evaluating and improving organizational performance in the public sector. And I think it is those aspects together with a systems thinking approach, systems approach that, again, is central to a lot of what the people in the forum are looking for. And another important principle is developing a culture of improvement, innovation, and learning rather than a top-down blame culture. And what I've found the best way to achieve that culture is to get senior staff together with staff service users in a workshop setting and ask them to focus on the outcomes, not about what their boss is requiring or what their department's requiring, but what these are the outcomes. They want to reduce obesity, want to reduce smoking, want to enhance climate change, reduce climate change, I should say. Whatever those outcomes are, get them together. And that not only helps you develop the strategy, but when you come to implement them, you've got people on your side. The staff and service users are on your side. And that was very much evident in a project we did here in Sheffield, where they spearheaded the idea of discharge to assess, which is when people are medically ready to leave hospital, instead of waiting in hospital until someone's decided where they should go and what support they need. They are discharged straight away, but with 24-hour support until their care plans are sorted out permanently. And now, if that was the sort of chief executive come up with that scheme, all the staff involved, the people involved in discharge, the occupational therapists, they would all tell the managers why it couldn't be done. They hadn't been involved, and they would just tell them why it couldn't be done. But because they were in the room, they were able to tell the managers, well, there are problems, but we could actually overcome them if we did this. And this actually really was very successful. It's now recommended by the National Health Service in the UK. A lot of people are trying to do it, saving a lot of money by releasing hospital beds for people who don't need them for a medical reason. So in general, though, it's been used in healthcare in a lot of areas, including reducing obesity. That one, actually, we integrated it with the theory of planned behavior because, even though we had senior managers involved, they couldn't get people to become more active or to eat more healthily. So we had to look at, so therefore we felt, well, how do we actually, get this program to work? We had £10 million of government money to do it. So how would we get it to work? And also, how could we evaluate it? But by bringing in the theory of planned behavior, we were able to look at trying to improve people's motivation to change, address the barriers that they needed to overcome to make those changes, and also attitudes of other people. And by linking that into the public sector scorecard, we were able to address those issues. And one of the things about the public sector scorecard is very flexible. So if you've got your own particular approach you want to do, it can actually fit in very much, as long as it's going to try and improve the outcomes, then it will fit in with the public sector scorecard. So I finished with a couple of quotes. One from the United States Performance Institute. The public sector scorecard is groundbreaking, and its innovative approach has transformed the way we measure success, shaping outcomes and transforming organizations, while the Operational Research Society described it as moving performance management from a top-down blinkered blame game approach to a system founded on inclusiveness, cooperation and understanding. So it's really about the way we work together with people which will really help us transform our public services. And I think that's the key to it. And so if anybody wants to contact me through the publicsectorscorecard.co.uk website or through the forum, then please do so. I'd be very interested in hearing from you. So thank you very much.